This is Ted. Ted is a 3-year-old boy who was born with moderately severe, rising to moderate conductive hearing loss for both his left and right ears. His hearing loss results from a condition known as bilateral microtia and atresia, by which he was born with a partially formed right outer ear, a nearly absent left outer ear, and an absence of both ear canals. This short video includes basic information about microtia and atresia, Ted's hearing loss, and tips for helping Ted to hear and communicate and fully participate in activities. Microtia is a condition that occurs in 1 out of every 8,000 to 10,000 births. It is Latin for the words micro and otia, meaning little ear. It can affect one ear or both ears, and is often associated with atresia, or the absence of an ear canal. Paul Stanley of the rock band Kiss is one well-known person who was born with microtia. As he once wrote, "Hearing loss may be a small pothole in the road, but that doesn't mean it should stop you from getting where you want to go. I am living proof." For Ted, microtia and atresia affect both outer ears and both ear canals, and he has never let that stop him from getting where he wants to go. Without his hearing aids, Ted's access to sounds is limited, and normal talking might sound like this to him.
From the Weather Channel, I'm meteorologist Ed Levy. Here's your San Francisco forecast. Variably cloudy, maybe a shower by morning, low 50s.
Here's what the same talking sounds like without a hearing loss.
From the Weather Channel, I'm meteorologist Ed Levy. Here's your San Francisco forecast. Variably cloudy, maybe a shower by morning, low 50s.
Fortunately, Ted usually wears hearing aids that enable him to hear at levels similar to what most people are used to. These are special hearing aids known as bone-conducting or bone-anchored hearing apparatuses, or BAHAs for short. Ted wears his BAHAs on a headband, and they transmit sound vibrations through his bone directly to his inner ears, bypassing the problem with his ear canals. Ted hears quite well with his BAHAs, but even with these wonderful devices, he's likely to make greater listening effort than his normal hearing peers. He also has difficulty telling the direction from which a sound is coming if he does not have visual cues. For this reason, there are some best practices to help him maximize his ability to hear and communicate. Number 1. Reduce background noise. Extra noise makes it especially difficult for people with hearing loss to listen and understand, and reducing noise from things like TVs or ambient music can really help kids with hearing loss. There are also several simple room treatments that can make a room a better listening environment for someone with hearing loss. These include adding sound-absorbent materials like rugs, fabric, and pillows to a room, and putting old tennis balls on legs of chairs so that they make less noise when they're moved around. Number 2. In a classroom environment, provide strategic seating for Ted. Ted will understand you best when he is seated in a place where he is nearby the teacher, can see the teacher well, and is away from loud appliances like heating and air conditioning vents. Number 3. In a classroom, use a personal FM system, which is provided by the school district. Using an FM system will make listening easier for Ted by making sure that the teacher's voice is loud and clear for Ted. The FM system makes it easier for Ted to hear teachers consistently as they move around in the classroom. In addition, any teacher or caregiver should be prepared to help Ted with the following when needed. Number 1. Re-anchor his BAHAs should they become loose from his headband. To re-anchor his BAHAs, simply tilt the sound processor slightly and carefully push it onto the headband. Please be careful to keep his hair out of the way. Number 2. Ensure that the right and left BAHAs are placed on the correct side of Ted's head and are pointed downwards. You can tell the left and right by looking at the battery doors. The R means right, and the L means left. Number 3. Ensure that the BAHA's safety lines are attached to Ted's clothing so that they do not fall off his body entirely and get lost. Number 4. Replace a dead battery in Ted's BAHAs. To do this, You open the battery door and insert the battery from the bottom. The plus side should be facing up. Doing these things will really help Ted have an easier time understanding you and help him participate in activities. Thanks for listening.